Hello everyone, my name is Robert Davidson. I'm the President and Founder of the Canadian Pulmonary Fibrosis Foundation. I would like to thank you for joining us here on our second IPF Awareness Day here at Queen's Park. We greatly appreciate the opportunity to revisit Queen's Park and ensure that the dialogue about rare diseases like IPF continues amongst our provincial decision makers. To begin, I would like to introduce you to Dr. Matthew Binney, respirologist and IPF specialist at Toronto General Hospital. Dr. Binney will speak to you about IPF and the current status of care and treatment available to Ontarians. Dr. Binney?
Thank you, Robert. My name is Dr. Matthew Binney. As Robert mentioned, I'm a respirologist at Toronto General Hospital and at the University of Toronto. I'd like to thank Robert and the Canadian Pulmonary Fibrosis Foundation for putting on this Awareness Day and for inviting me to participate. Idiopathic pulmonary fibrosis is a disease of unknown cause in which normal lung tissue is progressively replaced by scar. Patients typically present with dry cough and insidious shortness of breath, and initially the symptoms are mild. But over usually a small number of years, symptoms inexorably progress. The normal lung tissue is replaced by dense scar, the lungs become heavy and stiff, the work of breathing increases, and the lungs can no longer absorb enough oxygen to meet the body's needs. Despite supplemental oxygen, the person eventually becomes short of breath with any activity, and within 3 to 5 years of diagnosis, most patients will have died of respiratory failure or complications such as pneumonia. It is a devastating disease. IPF is considered a rare disease, but it affects thousands of people in Ontario alone. In my work in the Interstitial Lung Disease Clinic at Toronto General and with the Toronto Lung Transplant Program, I have met many fine and courageous people who have been afflicted by this deadly disease. For many of them, we have had little to offer. We counsel patients about their disease, we prescribe supplemental oxygen, we treat infections, we provide supportive care. The only definitive treatment for IPF is a lung transplant, which can be life-saving. However, many patients are not transplant candidates, and transplants come with many issues and risks of their own. IPF is a disease that is in desperate need of a cure. The history of medical therapies in idiopathic pulmonary fibrosis has been full of false starts and disappointments. Drugs that looked promising early in development have been ineffective when tested more rigorously. However, I am hopeful that a cure will be found. There is now intense interest around the world in developing drugs that can stop the progression of fibrosis without interfering with normal healing and other bodily processes. An antioxidant, N-acetylcysteine, may have some modest effects and is being studied further. Several other drugs are in clinical trials. In this context, it was a landmark event when pirfenidone, or Esbriet, was approved by Health Canada in 2012 for the treatment of IPF. This drug has been rigorously studied and shown to slow disease progression in mild to moderate IPF. Esbriet has been available in Ontario since the start of this year. Esbriet only slows the progression of IPF, and its effects are limited. It does not stop the disease, and it certainly is not a cure. However, at present it is the only licensed drug with proven efficacy in IPF. Our patients want to be treated with it, and we want to be able to prescribe it, particularly to those patients with mild and moderate IPF whose disease is getting worse. Unfortunately, Esbriet is expensive, and access is effectively limited to those with private drug plans and the occasional wealthy patient. Most patients with IPF are older and do not have private insurance. I appreciate that costly new drugs create a dilemma for any healthcare system, and especially for our publicly funded system in a time of restraint. However, IPF is a deadly disease, and this is the only drug we have. I would call on the Ontario government and the manufacturer to work together to find terms on which Esbriet can be made available to all of the IPF patients in Ontario who need it. Thank you very much.
Thank you, Dr. Binney. In October 2007, I was diagnosed with IPF. Like most people, I'd never heard of it. Once I looked it up on the internet, I soon found out I was in trouble. My life and the life of my family were about to go through some pretty big changes. Breathing was certainly going to be an issue. In 2009, I made a commitment to bring as much attention and awareness to this devastating and deadly disease as possible by establishing the Canadian Pulmonary Fibrosis Foundation with 3 key objectives in mind. the first to raise funds to finance research into the causes and possible treatments of this deadly disease, and hopefully one day find a cure. I'm very proud to say that to date, CPFF has raised more than $300,000 towards research. The second part of our mandate was to raise public awareness about this little disease, and the third, to offer support and non-medical advice to those affected by pulmonary fibrosis. On January 19, 2010, I was given a second chance at life when I was placed on the lung transplant list. No words can describe how I felt when I received the news 10 days later that I was chosen as a recipient for a double lung transplant. I was one of the lucky ones. Unfortunately, a transplant is not the reality or even an option for most IPF sufferers, and that's precisely why I'm here today. In addition, while transplants are great, there is always the risk of rejection. Dr. Binney and his colleagues have been working with me and for me for the past few months to fight two such attempts by my body to reject the lungs that were given to me. Last September 2012 marked the first ever IPF Awareness Month in Canada. The CPFF and the IPF community came to Queen's Park to raise disease awareness amongst the Ontario government and general public alike. This year our focus has shifted somewhat from awareness to access to Esbriet or pirfenidone, the first and only proven treatment approved in Canada for those with mild to moderate forms of IPF. Prior to the approval of Esbriet in October 2012, IPF patients had little to no hope of overcoming the disease. There was no proven treatment available to give them a fighting chance at life. The message patients were given was to get their affairs in order because this disease can progress very quickly. You can only imagine how hopeful the IPF community was when we heard that Health Canada had finally approved a treatment option. But that hope was short-lived when we heard the news that the Common Drug Review people recommended that public drug programs not list Esbriet. This recommendation was made by a committee that did not include one IPF specialist. The IPF community was deeply disappointed when the Ontario Ministry of Health decided to follow the guidance of CDR regarding funding for Esbriet. Patients and caregivers were confused and blindsided. We were left to wonder why our lives, our health, didn't warrant the same investment as those with cancer or other rare diseases. In addition, most IPF patients are seniors who rely on public funding for access to medically necessary treatments. We have nowhere else to turn. Over the past year, we've met with the Minister of Health and other Ministry of officials to educate them on this matter, and we're here today once again on an urgent plea, because with a disease such as IPF, time is of the essence. As Dr. Binney mentioned, Esbriet is only beneficial to a patient while the disease is in the mild to moderate stages. And it is very likely that today, while we're here urging the government to fund Esbriet, another patient in Ontario will be robbed of his or her chance to benefit from it as he moves from mild to moderate to severe. We are asking the Ministry to act now and reconsider its position on funding Esbriet to help those suffering from this deadly disease. Now I'd like to introduce you to Laurie Fowler, here today from Bowmanville, who is advocating for access to treatment on behalf of her mother, Virginia Curry. Laurie?
Thank you, Robert. My mother was recently diagnosed in March of this year with IPF. After the initial blow of my mother's diagnosis, it was equally devastating to be turned down by our government at our greatest time of need for funding for the one and only treatment that could give us hope. As my mother's disease progresses, my thoughts turn to those patients in the UK and Europe whose governments are funding this drug for their constituents. My mother, we have a large family. We have a loving family. She has 8 great-grandchildren, another on the way. We spend a lot of time together. And we would like to keep my mother with us for as long as we can. I would like to appeal to our government to do as Europe and the UK have done, and please help my mother and other IPF patients across Ontario with funding of Esbriet.
Thank you, Laurie, for sharing your mother's story and for speaking on behalf of IPF patients in Ontario. In conclusion, it is our community's greatest hope that increased awareness and education around IPF and the current treatment landscape will lead the Ontario Ministry of Health to reconsider its decision and to fund this much-needed treatment. We have lost too many too soon to this dreadful disease to give up our fight, and continue to be hopeful that the ministry will do the right thing. Thank you very much. And if there anybody who wants to ask questions from these people,